The United States government should provide a decent minimum of universal health care to its citizens. Daniel states that everyone has a positive right to basic health care. He says that this follows the principle of fair equality of opportunity, citing Rawls. He says the government should provide this health care to its citizens, and argues this based upon the principle of equality. Applying this principle to universal health care, if everyone has to pay taxes, everyone should be given health care because health care is a positive right. Similarly, the principle of equal opportunity states that equals should have the same opportunities. But if people aren't healthy, they don't have the same opportunities as people who are healthy. Similarly, the principle of justice states that people should get what is due to them. Currently, many businesses don't provide their employees with health care. These employees are active members of society, but the jobs don't pay them enough to afford health care. It's not fair for these active members of society to go without health care when many other active members have it. And this current system goes against the principles of justice and equality. Buchanan states that regardless of the government's obligation, the government still should provide health care to its citizens. He argues that even if health care isn't a right, it's still beneficial for government to provide a universal minimum of health care to its citizens. And he argues this based upon the prevention of harm, the idea that universal health care will provide an equal protection of citizens from harm. He also argues this based upon prudential arguments, stating that the availability of certain basic forms of health care make for a more productive labor force. As argued earlier, sick people don't have the same opportunities as healthy people, and universal health care would prevent this. Deva writes that the current cost of the United States healthcare system is much higher than the cost of the Canadian healthcare system, where it's a universal healthcare system. She argues that if the United States were to adopt a universal system, the cost would be much lower. And this is because currently, Americans spend much more on ER visits than on routine checkups, because many Americans currently are not covered, so they hold off on medical problems until they become so severe that they need a visit to the ER. And as the ER visits cost much more, the United States spends much more tax money on these ER visits than they would on universal health care and routine checkups to prevent this problem. Some worry that universal health care is a slippery slope that would lead to qualities and ranking somebody's life over another. But this isn't the case. Providing a decent minimum of universal health care simply covers basic treatments such as antibiotics, immunizations, and routine checkups. If a citizen wanted additional care, they could buy additional private insurance. But the idea of universal health care is a decent minimum so that every citizen has the equal opportunity to be healthy. Therefore, because of a positive right to health care, because of justice and equality, the prevention of harm and cost effectiveness, the United States government has an obligation to provide health care to its citizens, and regardless of this obligation, it still should, for the benefit of society.